Sarah's blood sample has arrived in the pathology laboratory for processing. Bloods arriving from the emergency department are given priority in the pathology lab and processed quickly. Today, Sarah's blood sample will be processed for a protein called troponin. Troponin, if found in the blood, can indicate that the patient has had a heart attack. There is excitement in the lab. A helicopter has arrived from an outback rural town carrying a small boy who's suspected of having meningitis. Josiah is 18 months old and lives about 200 kilometres away and is dependent on the Royal Flying Doctors. He's quickly processed through emergency and his sample of cerebrospinal fluid has arrived in the laboratory.
Hi, my name is Jeremy and I'm a medical laboratory scientist working at the Townsville Hospital. As soon as I looked at Josiah's cerebrospinal fluid, or CSF for short, I could tell there was a problem, as the sample was cloudy and I knew this was going to be urgent, as normally CSF samples are clear. A cloudy specimen would seem to indicate that Josiah's body was having a major immune response of some kind. So initially I prepared the microbiological plates, a cytospin gram stain, a cytospin differential, and performed a cell count so that I could look for a hint as to the cause of his problem, whether it being viral, bacterial, or perhaps parasitic. The plates are streaked to allow for bacterial growth. This will take up to 3 days and to allow us to clearly identify the organism and its antibiotic sensitivity. However, in the meantime, a gram stain will allow us to identify if the infection is indeed bacterial, and if so, whether the bacteria is gram-negative or positive, allowing for recommendations for empirical broad-spectrum antibiotic treatment until we can grow the organism. All significant results are reviewed by scientists and a report is prepared for the requesting doctor and the clinical microbiologist. Josiah's cytospin differential was significant as it contained polymorphs and other white cells, indicating significant immune response and therefore an infection of something pretty nasty. Our job is to now identify the cause. But while waiting to see if any bacteria will grow, we need to also check out other possible causes. During Josiah's original cell count, an increased number of white cells was noted, which led me to perform a differential on the cytospin slide, as was previously mentioned. However, whilst performing the cell count, I noticed a part of a white cell stretch out in a pseudopod-like projection. Now, alarm bells rang loud, as white cells don't usually move in a CSF, however parasites do. A quick scan of the rest of the counting chamber and I found several more white cells move in a similar fashion. I was on the phone straight away to our clinical microbiologist to inform him of these results and asked was there any further testing we could do right now to identify this potential parasite.
Think medical science might be a career for you? Speak to one of our biomedicine staff today.